Hey everybody, welcome to our virtual event. We are so excited that you're here and that you get to experience our live event today. So I'm Jaycee, I'm the Body Contouring Director at Behr Laser and Skincare Center, and we're so happy to have you. So we are going to give you lots of information, but just a teaser into what you can get being an attendee at this virtual event. So we're going to have a raffle prize of a CoolTone series, and then we're also going to be doing some giveaways and little things, but also we're going to have some specials. So purchase a CoolTone series and receive a CoolTone series, and also if you purchase a CoolSculpting package, you will also receive a CoolTone series. If you have any questions during the event, make sure you put them down in the tab, and also make sure you answer yes at the very end, but questions will be answered at the end for our Q&A, so I'll be popping in to answer anything that you guys have. This is the time to answer any questions. If you've been wanting to experience CoolSculpting or CoolTone and you need to know more, this is the time to do it. So make sure you stick around to the end, and we'll see you then. Hey guys, so we want to give you a little bit more information about our CoolSculpting Elite device and why we love it so much. So this is one of our CoolSculpting Elite. We have two devices. This allows us to dual sculpt patients, which is the newest technology with CoolSculpting. So here at Behr Laser and Skincare Center, we always are having the most latest technology for you. That is our goal, to give you the latest and greatest. So the reason why we love this so much and why we brought it on is when CoolSculpting updated the device, they actually went from having one applicator to two. This helps minimize the time that you need to spend at the office, which we're really fun to hang out with. But this allows for more treatments for you, more comfortability. You're not here for hours. It's cut the time in half, and we're really excited to have this technology in our office. So to answer the question about why this device and why not other devices, there is other devices on the market that have cryotherapy built into them, or some people use radio frequency RF technology as well. So CoolSculpting has been studied for a very long time, and it works very, very well. CoolSculpting was actually developed by Harvard physicians that actually found that children that were eating ice cream and basically popsicles were getting apoptosis of fat cells in their cheeks, and this is how CoolSculpting started. So it's been a long time coming. CoolSculpting has evolved from using parallel plates to the CoolSculpting Legacy devices, and now the CoolSculpting Elite. This is the most non-invasive way to contour the body. The great thing about CoolSculpting is that each and every one of our applicators that you see behind me contours to you and is customized to you. Not all devices can customize that way like CoolSculpting Elite can. So CoolSculpting Elite can treat almost any body area, which is awesome. So we can not only treat like the submental region, we have areas such as bra fat, abdomen, flank region, inner and outer thighs, arms. It's very customized to what you need, and it's very versatile in the ways that we use it, and it is the greatest way to non-invasively treat adipose tissue on the body. So who is a candidate for this device? So most people are a candidate for CoolSculpting, but depending on where you're at with your journey depends on how many treatments we'll need to do. So this is not a weight loss option. So if you are looking for something like that, we do have LeanMD and some different options for you to help you guide you through your journey to get to your CoolSculpting part of your journey. Now, the best way to utilize CoolSculpting is for body contouring. So when we've been working out, we've been utilizing our dietary options and things like that, and we're down to where we kind of want to be, and genetically maybe we're predispositioned to having little pockets of tissue that we may dislike. So at that point, CoolSculpting would be a great option to contour the areas where we haven't been able to work them off, or genetically they never go away. This is where CoolSculpting is utilized the best. So CoolSculpting has minimal downtime. So With that being said, when CoolSculpting is being applied, and you saw Ruby in the video being applied, and she's experienced CoolSculpting before, so you will experience a little tenderness the day of, a little tenderness the next day, and sometimes bloating. So bloating is a good reaction to CoolSculpting. Bloating is bringing water to the area to help lymphatically drain the fat cells that we just killed. So they went into full apoptosis, and now it's your body's turn to lymphatically drain them. So there might be minimal discomfort, but we do recommend Advil or Tylenol after, and that will help to kind of relax the area and not feel a little bit of discomfort. Also Spanx or some nice tightly fitted athletic wear will help to kind of keep it controlled and help lymphatically drain a little faster. With that being said, very minimal downtime in compared to like liposuction or different options that are more invasive. We have thousands of patients that we treat, male and female, and they do really well with CoolSculpting. So with CoolSculpting, where do we see our final results? So CoolSculpting, you will start to see results in as little as 4 to 6 weeks, but your final results will come 12 weeks after your final treatment. So we usually do 2 treatments, sometimes 3 or 4, usually 2 treatments. It does take 2. From there, you will reduce fat slowly but surely, but 12 weeks is your final results. But we do see you back for your next treatment at about 4 to 6 weeks. We will take progress check photos and show you your results that are starting, and final results will be at 12 weeks. So we're here with Ruby today. We have been treating Ruby and we've been transforming her. So we're down to our last round of CoolSculpting. We're going to be treating her lower abdomen. This is the area where she has a little bit of excess adipose tissue remaining. So this is great for CoolSculpting to contour this little area that's bothering her. So we're going to map out our treatment plan. So what I'm doing is providing markings where her adipose tissue starts and stops and where the peak of the adipose tissue is. CoolSculpting predominantly works best when placed over the pockets of adipose tissue, placed right in the center where the most adipose tissue is present. So we're going to see which applicators work best for this. So we're going to go with a C150 applicator. That's going to best contour Ruby's body. We will end up doing 2 applications. They are 35 minutes. So we are going to align the applicator with the center of where we marked. This is going to help contour Ruby's abdomen even further and help her achieve her goals of a flatter abdomen. And then next we're going to get her all situated. All right, so we're going to be starting treatment for Ruby. So we have our pre-treatment wipe. This is going to start protecting the skin. Most importantly, protecting the upper epidermis so we don't have any skin irritation when the cold hits the tissue. And now we are going to be applying our gel pad. So what this is kind of like a honey mixture. Again, it is a protectant for the tissue to make sure that it's going to be protected during the colds. With CoolSculpting, we are administering cryolipolysis to the cells, which means we are making those fat cells at negative 11 degrees Celsius. And when that happens, we don't want to irritate the upper tissue. We want to make sure it's nice and hydrated during our treatment and not irritated. So this is what's going to help protect us. So Ruby is a little tender after, but not anything that's irritated after the cold. So the applicator has a mild amount of suction. It's not a big suction, but we're just gonna let Ruby know that you're gonna feel a little pressure, a little bit of a suction. The treatment is not gonna be on as soon as we apply pressure. I will let you know as soon as we get started and you'll start to feel the cold. So once the applicator is suctioned onto the area, it is exactly where we want it to be, and the tissue is inside the applicator, which is where it's going to be treated successfully and keep it at that negative 11 degrees Celsius temperature. Grab a boppy to secure the applicator. This helps hold it in place and also take some pressure off of Ruby. You're gonna make her nice and cozy. For the first 5 minutes, you are going to feel a little bit of cold starting. From there, for the first 2 to 3 minutes, you are going to feel a cold kind of burning sensation, kind of like holding an ice cube, or if you've ever put your hands in snow and tried to warm them up, that burning cramping sensation. This is from the nerve endings, so they're not being damaged, but they don't like very hot or very cold temperatures. You'll get this reaction, and it is very common. From there, they do go numb. They kind of go sleep. From there, they go numb for the next 30 minutes, and then when we remove the applicator, you will feel that slight sensation return, but it's temporary and it will go away. We do put some hot compresses, and it does go away in about 2 minutes. So now what we're going to be doing is removing the applicator. We are going to be doing the massaging portion. So the reason for the massage is that we did kill a portion of the fat cells and they are in full apoptosis, but some of the fat cells are just injured, and in order to make sure that all the fat cells are fully in apoptosis, we bring warm blood flow via lymphatic massage to make sure that all those fat cells are killed that we want to treat. I want to thank everybody for joining us and learning a little bit more about CoolSculpting and CoolTone. Wanted to mention, if you didn't get all your questions answered, stick around to the end for a Q&A. We will have a live one-on-one with myself and Dr. Behr that'll be going over any questions that you have that didn't get answered and you want further detail on. Also, at the very end of this, you'll be receiving a text message. If you would like a complimentary CoolSculpting consult and to be entered into the giveaway, make sure you reply yes to that text message. Again, that'll be entering you into the giveaway, and also to receive a complimentary CoolSculpting consult for giveaways. Attendees who win, which is very exciting, CoolTone series, you will be notified within 24 hours. And again, we want to thank you for joining, and we're so happy to see you.
Hi, welcome everybody. Jaycee did a fantastic job. Jaycee's our expert. She's a trainer for CoolSculpting. She trains many different offices. And, we've had this technology in our office for a long time, and we're so happy that, it has completely continued to evolve from how we started using it in the beginning. And we have Jaycee here as an expert to help each of our patients what we want to do. So we have some questions here that we're going to answer. And if you have any other questions, make sure you type them in so we can answer them for you. So here's the first question. Do I need to be at my goal weight to get CoolSculpting?
It's a great question. So we do treat a lot of different patients. So you can be at your goal weight, you can be close to your goal weight, but if we are far from our goal weight, then we do recommend Lean and Be first to help you lose a little bit of weight. That way we could do 2 treatments of CoolSculpting to get you closer to your goal much faster. We are treating within, I would say, about 20 pounds of their goal weight typically, but we treat all shapes and sizes, and everybody is welcome.
The thing that make sure you're aware of is CoolSculpting is not for weight loss. So even though it can really contour an area and shape you well, it's not going to give you any weight loss on the scale. And you want to stay at the weight you're at after you get that contouring, because if you gain weight, you may gain some of that back. So it's a great thing for contouring. But when we see things online that says, oh, CoolSculpting doesn't work, I didn't do that, I think that's when people expect like CoolSculpting to have them lose weight. Well, it doesn't, but it does kill fat and it does help contour. So that's really what we wanted to educate people, that there's certain things that it can do and it does very well, and certain things that it doesn't do. Let's see, how many treatments are usually needed?
Typically it takes 2, but we do sometimes treat 3 or 4 times depending on the patient, depending on how much adipose tissue is present and what their goal is.
So those are done in treatment sessions, and sometimes, those treatment sessions, include many different applications, and Jaycee is a pro at making sure where the peak of the fat is and get the most fat killed with that. So usually, it's 2 treatment sessions, and that's changed a lot from when I first got CoolSculpting a long time ago, how many years?
12
12 years ago, where people came in and we treated like one application and thought, oh, we're done. And then it kind of went out of favor because we really realized we really need to treat to complete. So that means we need to put many different applicators on and have the 2 treatment sessions to really get the great results with a stable weight. Who is a good candidate? We kind of already went over that. Let's see, how many treatments are needed? You know, like I said, that's really individualized. People have to know it's not for weight loss, but it does do a great job of actually killing the fat, and that is permanent as long as you maintain the same weight. If you gain weight, you're going to gain weight in some fat cell somewhere on your body. How is the cost? Is it by treatment or package?
So cost depends on our treatment packages. Most people do about 8 cycles or 8 treatments. So what that means is 4 applicators each session that we do. So typically that runs about $33.50 in our office. You can see, depending on if we're doing abdomen, flanks, multiple areas, that cycle amount will go up for coverage of those regions. So I would say between $33.50 up to, I mean, even $6,500, depending on how many areas we are covering. But again, that's non-invasive. You can go about your day-to-day, you know, activities, workouts, all the above. You have no downtime and 25% fat loss every time we treat.
Yeah, it's great. And what's the difference between CoolTone and CoolSculpting? Can I do both?
So you can do both. We actually definitely guide both of those 2 things together. CoolSculpting kills fat, CoolTone builds muscle. Those 2 together get you closer to your goal. You're toned, your fat is gone. We're doing both of those things. Also, especially with the abdomen, doing abdomen, the CoolSculpting, and then we do some CoolTone after. That helps with some lymphatic drainage too. It just helps expedite your weight loss goal or your journey for CoolSculpting, and it also helps motivate you to continue your routine of working out and keeping those goals for after your CoolSculpting journey.
Okay, great. Here's a good question. When will I see results?
So that's a great question. CoolSculpting, you can honestly see results even 2 to 3 weeks after your procedure, but your final results are 12 weeks. So once we CoolSculpt and do our job, it's your body's job to lymphatically drain all those fat cells. As you saw in the video, lymphatic drainage takes about 3 months to see your final results with CoolSculpting. But when we see you back for your next treatment at 4 to 6 weeks, we do take progress check photos. You are seeing results at that time, which is motivating to see your final results. And it's the gift that keeps on giving, and people get really excited. But 12 weeks is your final results.
And this is a great question. Is CoolSculpting just for the abdomen, or what other areas can be used? So that's a great question.
So that's awesome. CoolSculpting has 9 different FDA cleared areas of treatment, head to toe, which is awesome. And with all the applicators you saw in the video behind me, we can customize all of those treatments to your body. So most commonly abdomen, flanks, submental, arms, bra fat,
outer thighs,
inner thighs, top of the knee, so distal thigh is what they call it. It's top of your knee if you have a little pocket there. There's multiple areas, and it's commonly used in the abdomen, arms, and flanks. I would say it's majority of what we CoolSculpt, but you have a pocket of tissue and it's an area we can treat. It's definitely something we can do for you.
If you can get into the cup, we can usually treat it. And how does it compare to Cellotech high definition liposuction? So that's the thing. We do liposuction. We do a lot of different things in the office. CoolSculpting's, one of our most popular. I do liposuction. We also do a lot of, CoolTone and other muscle toning. So, I mean, this is really non-invasive. It's safe, for all those patients, even if you can't undergo surgery. It does take multiple treatments, and you're killing a percentage of fat each time. Liposuction is also a great procedure. It's much more invasive, and you can contour that a little bit better, but both of them work very well. It just depends how big an area you want. And sometimes, somebody will come in for one consult and they'll get moved over to the other area, which is great because we do both in the office. So sometimes people come in for a consultation for liposuction and we move them over to CoolSculpting. And then if we think they're actually a better liposuction candidate, then we do what's best for the patient. Does this work for double chins?
Yes, we love to treat some double chins. I know we all had a great December and holiday
but we also all probably gained a little weight, so that double chin starts to show up in our selfies, and it's something that CoolSculpting can take advantage of and treat. We typically do 2 applicators, but sometimes we can contour the full jawline, which is awesome. So even visually, if you're in your weight loss journey and you're wanting to lose weight, but maybe that's the first thing you see and it's driving you crazy, that's something we can treat at a higher BMI and a higher weight, because prominently a lot of people get fat under this area, and it's something that is very non-invasive, easy way to treat, and you do see results a little bit quicker in this area. It lymphatically drains pretty fast, and it's a very common area that we treat, and it's very successful.
Is this good for severing belly fat?
Yes, all the above, and it doesn't matter. CoolSculpting doesn't care if it's estrogen dominant fat, hormonal fat, stress fat, any and all. The only thing it does not treat is visceral fat, which is inflammatory fat, and that is something we lean toward Lean and Beef for, to help to eliminate that fat behind the muscle. CoolSculpting treats adipose tissue on top of the muscle, your pliable, squishable fat. It is a great way to treat stubborn belly fat in a very non-invasive way, and also no downtime.
Okay, will this treat saddlebags on the upper outer thighs?
Yes, so we have a special applicator called the S150, or the Smooth Contour. What that does is administers cooling in a flat plate, so we're not taking a chunk out of your outer thigh with a curved applicator, so it fits perfectly to the outer thigh. That treatment is about 75 minutes long. You have both applicators on the outer thighs. It gets to -13 degrees Celsius, and it treats very, very well. We do those treatments about 8 weeks apart. Limbs take a little bit longer to lymphatically drain, so we want to wait to make sure that we're not taking out too much fat, but it's a very common area as well that we treat. As long as it fits in the applicator, we can totally treat it.
Awesome, great. And does the treatment leave loose skin?
So that all depends on age, sun damage, how is your skin presently before we take any adipose tissue out. I've had a 75-year-old lady today that was absolutely amazing. She was in great shape. I see 30-year-olds that have been out in the sun in tanning beds, and honestly, it all depends on the skin. Have you had babies? Have you been pregnant? Do you have stretch marks? Have you gained weight, lost weight significantly? There's so many different variables in that process. So the biggest thing is you coming in, evaluating, and we can kind of set up that expectation of, if we remove this fat in this area, you might have the possibility of skin laxity, but there's a lot of things that Dr. Behr can do as well, non-invasively and invasively, that can help you along your journey if we are concerned with skin laxity.
How long does it last? It's permanent, so the fat that it's killing is in a specific area. And like I said, it's not for weight loss, but it's for contouring, but the fat that it kills is gone. There are other fat cells, and it would never, even with liposuction or other procedures, not remove all the fat from an area, because we have fat underneath our skin everywhere, which is normal, but it is permanent. What are the side effects?
So there are a few side effects that can happen with CoolSculpting. I think everybody's main concern, I think, is paradoxical hyperplasia, and we'll just jump right into it. So pH, for short, is something that can occur, and it's a rare side effect with CoolSculpting. This occurs when the fat doesn't break down and go into full apoptosis. It becomes inflamed. So it's presently right where we put an applicator anywhere on the body. It is a rare occurrence. If this were to occur, we actually work with CoolSculpting, and it's a very easy process, but it's inflamed fat. The only way it can be treated is with liposuction. So as long as it's diagnosed by a physician, Dr. Behr, or anybody that you see with CoolSculpting, it is diagnosed. We work with CoolSculpting, and it's something that CoolSculpting works with us, and we get that area treated for you with liposuction, and it is fixed that way. It's not a permanent defect to your body. There is a treatment for it. That's the best part about pH. It's something that can occur. It's very rare, but there's side effects to any cosmetic procedures that we have. Botox, fillers, laser, all the above. Ibuprofen that you take, their side effects. So all the fun stuff.
Yeah, so their side effects are very low and very low risk from CoolSculpting. But like Jaycee said, any procedure has side effects, and this is one of, when I've been on ad boards and everything, this is one of the lowest, it has the lowest amount of side effects with it. So, and it's side effects that we can take care of. What are the event specials, and how long do I have to take advantage of them?
So our specials for this evening are if you purchase a CoolSculpting package that you'll receive 4 CoolTone treatments, so 4 muscle toning treatments as well with your package. We also have a BOGO for CoolTone, buy 4 treatments, get 4 treatments. So, and how long do they have to take? 24 hours?
I think they'll call them and then they'll, if, as long as you reply yes and we get a consultation scheduled, then it will be, once you get in, you'll be able to take care of it. Here's a great question. I'm just about done with M-Sculpt treatment. How long do I need to wait to begin CoolSculpting, and would this just be beneficial or overkill?
So if you just got done with muscle toning treatments and you want to begin CoolSculpting, if you have pockets of adipose tissue that are still present after your M-Sculpt, then this would be a great way to contour those areas for you that you have concerns with still. I think CoolSculpting for anybody at any part of their journey, as long as they're close to their goal weight, is always a great way to contour and eradicate those areas of concern for you long term.
Can I start if I'm breastfeeding?
Typically with CoolTone, we do allow it. It is a workout. CoolSculpting, we typically don't have people come in if they're pregnant or breastfeeding. You are lymphatically draining with CoolSculpting. We don't want to modify it. We've never studied it, so we don't want to render any situations with ducts, lymphatic drainage, or anything like that. So we do refer over to our medical advisors, but typically CoolTone is something that's a workout, but CoolSculpting, we do err on the caution for that.
Yes, great. For the area of bra fat under the armpit, is that possible? So we do it, under the armpit in front, we do it into the back. Those are both areas that it really helps. Back of the arm above the elbow, we can do those areas. We also have different procedures and different medications to help improve the elasticity. Often we'll do different dilute radius or different fillers that help with thinness and help stimulate that. We have more invasive procedures like Renuvion that help tighten it. The price range for a double chin area, usually it really starts with probably 2 treatments twice.
I would probably say that's going to be about $19.50 for 2 treatments on the double chin if we're using 2 applicators and repeating that in 4 to 6 weeks.
Do you suggest not exercising the same day after my treatment? Will it cause me to swell?
I definitely recommend working out if it's tolerable and you're not too tender. Some areas can be more tender than others. Everybody has different pain tolerances, but lymphatic drainage and working out is the best combo you can do. Sweating, drinking lots of water, getting your body moving. It's going to help the flow of your lymphatic system, and it's a great way to get rid of that bloat a little faster.
Yes, great. It can help stubborn fat in the lower abdomen from C-sections. Yes, we definitely do that. We're really, great at treating all areas over on the abdomen. Banana rolls, which is the little rolls under the buttocks. This is something that CoolSculpting can treat, and I'd rather CoolSculpt that than do liposuction, because those you have to be very careful with and only kill the superficial fat. Otherwise, you'll get a drop of the buttocks. So you can, and that is one of the areas that we can treat with the CoolSculpting.
We definitely do a lot of banana roll, and then also do muscle toning to the glutes or the buttocks to help lift, and that will help with the lower banana roll.
Yes, definitely. Yeah, you want to lift and build that buttocks to help that muscle. If you are doing Neo, do you do cool toning? So Neo is also one that has muscle toning, but also can kill some fat. But we do sometimes do cool toning to build the muscle more, can be done with it.
So it's just like you don't do one workout. You want to do different workouts. Like some people like to do yoga, Pilates, high fit, boot camp, Orange Theory, all the above. In my eyes, not one workout is going to solve all of your problems. So sometimes doing a mixture of the workouts does help your body perform better and building muscle too.
Okay, perfect. Awesome. So let's see, lymphatic massage, sometimes that can help with the drainage, like in, walking, drinking lots of water, all of that is good things. So, we had a great time Answering all your questions tonight. Remind everybody, please respond yes, so you can get specials and get entered into our raffle, and then come in and get a consult, because again, everybody needs a personal consult to see exactly what's right for them. And Jaycee is an expert, and we'd love to see you in the office. So thank you all for attending, and we'll see you soon.
Bye, guys.